Greetings, everyone. This is Sal Munoz with All Chicago. We are going to get our presentation started, but we are going to give the folks some time to join us. So we are at a little under half of what our attendance should be of our registered people. So we're going to give them about 2 to 3 minutes to join us. Again, we're going to delay the start of the webinar a little bit by 2 to 3 minutes. Just let everyone else join us. All right, everyone. Thanks so much for waiting. We're going to go ahead and get started. Now, a little bit of housekeeping before we get going. I'm going to be addressing questions after I get through the presentation. So again, please send in your questions. Send them in as, uh, we want to keep an open line of communication with you, but we may not have enough time to address every single one of your questions during the webinar itself. So we're going to wait until the end of the webinar to address those questions. And I ask that you use the questions function of the GoToWebinar dashboard, as opposed to the chat or raising your hand. So again, I'm going to be only looking at the questions function. I will not be unmuting anyone, and I will not be checking the chat function. And I also have 4 handouts in the GoToWebinar navigation pane. So I have the data dictionary, a PDF of HUD's data dictionary, the slides that we have that I'm presenting on today. Then we also have a pair of slides from our vendor that goes over some of the minutia of the changes that we are basing a lot of this presentation on. And then we have a draft universal intake form that will be going live on Monday. So this draft universal intake form is really there to be able to give you a little bit of a sense of how we are going to be documenting the intakes, and just all the general assessments. So let's look at what we are going to be tackling today. Now we're going to talk a little bit about the context and the timeline of the 2020 HMIS data standards, and we are going to be talking through the upcoming changes. Towards the end of the presentation, I'm going to talk about the proposed questions by the data work group that will be implemented on October 1st. They're going to be optional, but we're going to go over why they're important and why they're encouraged. Then we'll review the actual intake files so that you get a sense of how you can adapt that intake file for your own use of the agents, at your own use at your particular agency. And then we'll go over what's next. Now, I recognize that some people may actually be coming back to this webinar. Earlier in the month and in August, we had told folks that we are waiting on on a staging site to be able to preview the actual changes that will be occurring through HUD. So the vendor set an expectation that this would be up by September 1st, but then HUD had minor adjustments on their data standards, so then it delayed the vendor. And unfortunately, we don't have any previews. We don't have any actual images in Service Point to actually show you, but what we are going to show you is to talk through the paper intake, because we can at least control that, and talk through what it will look like, since the paper intake is so similar to how we document. The paper intake is built to reflect how we document things on our entry assessments in HMIS. Now, these data standards updates are the first set of changes since 2017. We did not have any updates in 2018. We have two different implementation dates for this go around. We have October 2019, and that's going to be, Tuesday of next week, and the majority of those changes are going to be assessment questions being updated, answers being adjusted, Picklist items being adjusted, etc. And then we also have another implementation date for data standards in April 1st, 2020, and that's when CES data standards go into effect. So HUD has not released the reporting requirements on the CES standards or some of the data elements that we're going to be tracking, and how they want those data elements collected, or at least reported out on. We have the data elements, but the mapping of it has not been fully designated yet. So we're going to have more information on the updates to the CES data standards further down the line. But for now, what we're going to be concentrating on are those changes that will be going into effect on October 1st. So the WellSky is our vendor. They are the software vendor that operates Service Point, which is what HMIS is built on top of. They implement these new data standards into a first iteration for us to build off of. And as you can see here, this iteration is usually released in September. These changes in Service Point won't be totally apparent until the corresponding tables fields are created by the vendor. We do not have that. That date we are towards the end of September. We do not yet have it, but what we can do is control what the intakes will look like. So one thing to keep in mind is that the majority of our presentation today is going to be talking through what the questions will actually be, how the intake flow will actually work, and just know that the intake that we'll be filling out is very similar to how these will appear in HMIS. Now, here's the timeline that we had. Back in May, HUD released their new data standards. They released version 1.1 of the 2020 data standards. And in August, we began the process of telling everyone, hey, get your folks trained, register for a webinar in September, and really just informationally letting everyone know in the community that these changes are coming abroad, that they're coming on board. Then in September, we are supposed to have had the changes to the assessments implemented in the training site. This did not happen. This was not implemented. So typically what we try to do and what the vendor aims for us to be able to do is to have a staging site where we develop some of the assessments, and ATAs are able to preview what is in there before it goes live. This is not the case this year. The vendor has not been able to implement these changes so that we can preview them and give a preview to the general community. So what's going to happen is that on October 1st, the data standards have to go into effect, and you're going to notice that some of the pick lists and some of the pick lists and sections will be shifting slightly, and we're going to get into how those changes are going to be occurring. And then on October 1st, of course, these are going to be implemented. The HMIS team is going to be updating all of your assessments throughout the system to reflect the new 2020 data standards. So we're going to talk about 3 major areas of change that are stemming from these HUD data standards. And when I say major areas, there are some small changes that are happening to SSVF providers, RIDE providers, small pick list changes. We're not addressing those today in this particular segment. What we're trying to do is get the big picture stuff out of the way so that you all know what the big picture things are going to be changing. A lot of the other changes, the pick list changes, are relatively minor. So for one, we have the project descriptor data elements. Now, what does that mean? What does the project descriptor data elements actually mean? What it means, it really just impacts when you create a project. That's all it does. When you create a project or when you update your unit list, when you create a unit list, when you update your unit list, whatever it may be, we are going to be asking you more questions about that unit list when you create a project when you fill out one of the project data creation forms. We're going to be asking you additional questions about your funding source information, etc. So there's going to be more administrative work when you're going to be, not necessarily work, but rather additional areas, additional fields that you'll have to be answering when you go ahead and create a project or update a unit list. And really what we're going to be asking for the unit list, because that is probably what is going to impact the majority of people, is that now we're going to ask you what dedicated number of beds you have to youth veterans, chronically homeless veterans, chronically homeless youth, etc. So we're just expanding this subpopulation list, trying to see what beds are designated to whom in the system. So again, the impacts of this are relatively small. You're just going to have to answer a couple more questions when creating a project or updating a unit list. And here, this is what we currently see in in your project setup, right? So anytime you set up your project, this is what we fill in, and the form that we have you fill out when you're creating your project is almost pulled directly from this one that we just insert into. And then of course we have our bed and unit inventory list, and you can see here that these subpopulations are right in the middle. That's going to be expanded, and that's really the major change that's going to happen. So again, just some additional fields that you may have to consider when updating your unit list. Now here's a set of major changes that are happening: the pick list adjustments and wording changes. So first off, many of you are probably familiar with the question that is current resident slash living situation. So in the system, current resident slash living situation has always been designated to say, where was a client the night before they entered your project? Well, now that's going to be actually, now the wording for current residence living situation is going to reflect what they're actually asking. So that's changing from current residence living situation to prior living situation. And again, prior living situation is going to be asking, where was a client the night before they entered your project? Then we have the addition of a new question called the current living situation. And the current living situation is not where the client was the night before. It's where is the client now? So let's, before we go into the scenario, one other thing to note is that the pick list, the answers for each of these questions for prior living situation, current living situation, and exit destination are going to be reworded so that they align as much as possible. So if you say that your client was in a prior living situation in an emergency shelter, then their current living situation is a PSH project with you, and then their exit destination is to rental unit where they're now able to self-sustain themselves. So it's no ongoing housing subsidy. All the pick lists have been generated so that it's consistent between each of these 3 points in your client's lifetime, life cycle in HMIS. So here is one important thing to take a look at. We have our previous living situation and our current living situation. So current residence living situation, it will now straight up be becoming previous living situation. So this question is effectively being replaced by this, but now there's sort of this additional question being added called the current living situation. So what is the distinction between the two? Now, what I'm going to toss out a scenario where our client may be entering an emergency shelter, and the night before and typically they're sleeping on the CTA. So for the most part, they're always on the CTA. They're always sleeping there, and this was the first night that they stayed in shelter. So if you were to go through this assessment, what you would be doing is answering that the previous living situation is a place not meant for human habitation. So they're living in they're living on the bus, they're living in the CTA. And the current living situation for that client is going to be emergency shelter because they're coming into your emergency shelter. So the current living situation, if they're enrolling in your actual project, it's going to be wherever they are in that moment. Now, another scenario, if you're a PSH project, when you enroll a client, you're not necessarily going to house them immediately. So let's say that your client the night before was staying in an emergency shelter, you'd answer in previous living situation, emergency shelter. And then for current living situation, it's also probably going to be emergency shelter since you're working to actually house that client. And again, we're talking about PSH projects, which enroll clients, and then only when a client has a housing move-in date, that is when they become permanently housed. So keep that in mind. The current living situation is literally where is this client sleeping today? Where are they going? Where are they staying at? Where are they going to be resting their head? And then, of course, previous living situation, where were they the night before they entered your project? So then we have then we have a couple of additions to the exit destination, and that's going to be host home, a non-crisis host home, rental by client with HCV voucher, housing choice voucher, and then rental by client in a public housing unit. So these are going to be added only to the exit destination, not necessarily to the prior and current living situation pick lists. Now, current living situation is also really interesting. So all the questions linked to prior living situation are going to have your traditional chronic homeless questions. Prior living situation is going to bring up, approximate date homelessness started, how long has a client, how many months has a client been homeless over the past 3 years, how many times over the past 3 years has a client been homeless, etc. So the typical questions that we know that we know of when trying to discover a client's chronicity are going to be attached to the prior living situation. Current living situation is a little bit more interesting, and these are collecting new data elements that are trying to sort of gauge at the different types of categories of homelessness, categories of housing crises that clients have. So most of you probably already know there's a category of literal homelessness. That means that a client's sleeping in a place not meant for human habitation or an emergency shelter, a safe haven, etc. But then there's also an imminent risk of homelessness, which means that that client is literally going to be literally has to leave their current location in less than 14 days, and they have not had a subsequent residence identified. And then there's a third category of housing crisis where it's the closest thing to what we would consider HUD having of doubled up. So that's going to be has a client had to move twice in the past 60 days, and have they had a lease or the keys to one of those locations that they were staying in. And that's starting to get at who is sort of being who's doubled up, who's couch surfing. So these questions, as you could see them, they're going to be prompted by telling us where the client's currently staying. Then it's going to very similar to prior living situation, it's going to have a conditional logic. So then it's going to ask, is a client going to leave their current living situation in 14 days? Depending on how you answer this, it'll be yes or no. Then it'll go to this next question, which will then go to the next question, which will then open up the next question, etc. So again, these are going to be very similar to how the conditional logic works in trying to find a client's chronicity. Now, I want to talk a little bit about the coordinated entry data elements, just really quickly. So the major thing that is going to be collected through the coordinated entry data elements is that it's going to want to look at the client progress, referral outcomes, and events of that client's life cycle in the coordinated entry system. These are already elements that we're more or less already tracking through our current coordinated entry workflow. The work that'll probably have to be done is the administrators, us, the HMIS lead, mapping that over to whatever new field, whatever new data elements HUD is going to want to collect through service point. So just keep in mind that we expect sort of a very minimal impact to coordinated entry, to skilled assessors, because for the most part, we already scaffolded up workflow that is very thorough and collects all of the elements that HUD has been indicating to us. So some of the new coordinated entry data elements, there's an assessment element, which is really just, did they do the assessment, where was it, and what were the results of the assessment? Then we have the coordinated entry event, which is really just measuring the referrals. You may already know that the events that are there, an event is when a referral goes out, when a referral is updated to show that a client has scheduled an intake, then the client is enrolled, then the client is housed, etc. So those are the events that happen through the coordinated entry event data elements. And then of course we have current living situation. So it may be interesting to know that the current living situation for skilled assessors is really going to be pretty important, right? We have a lot of people that have been assessed by street outreach, by drop-in centers, and that client's current living situation may change pretty frequently, but they may not be in the system. They may not be living in an emergency shelter, permanent housing, or whatever it may be. They may be couch surfing, and this current living situation is going to be a way to better identify those folks that are unsheltered, but don't access any emergency beds in the system, etc. So current living situation will really help those service-only projects keep a better track of what their clients' living situations are as they update their cases. So now we have some additional questions for intake. So these questions are largely going to be, these were recommended by the Youth Data Work Group. I don't have a representative of the Youth Data Work Group here with me, but I'm going to go through these questions and talk through some of their reasoning as to why they had added these, why the need for these had arisen, and then I'll talk through what the rollout in HMIS is and why HMIS is going to be implementing these across the system, and how we're going to be doing that and the impact it'll have to data quality, which it won't initially. So let's take a look. Now, to give you a little bit of context, First off, these questions are not being mandated by HUD. These questions are being proposed by the Youth Data Work Group, and they have been reaching out to multiple different providers. Some of the ATAs who are on this webinar may remember that they came through to our ATA meeting to talk through these questions, etc. So just know that the HUD data standards are different than these questions. These questions are a decision by our community to adopt them, whereas the HUD data standards changes are always mandates by HUD. Those are things that we're required to update. These questions are optional, but they're really helpful, and they'll help move forward our continuum as a whole. And one thing to note is that these questions were proposed by the Youth Data Work Group, and they're really there to help improve the system data and align with USICH national benchmarks. So why would we need to add these additional questions? Well, it all happens when we provided Chapin Hall, which is a research entity, data on youth. So we gave them HMIS data so that they can begin to understand what youth homelessness looks like. But the thing is that this information that they were given isn't consistent for every single young person. So one thing to note is that when a young person goes to a emergency shelter that's funded through youth dollars, that's funded as a youth project, that youth is going to have a different set of questions asked for them as opposed to a client that may go to an emergency shelter that's designated for just a general population, right? So if my client goes to youth agency A, they're going to have a series of questions asked that are going to be asking them about education, employment, parenthood, etc. But if they go to just a general emergency shelter that has both adults and youth, etc., we're not going to be asking those questions about those in-depth questions about employment, those in-depth questions about pregnancy, parenthood, education. They're going to get the basic HUD entry assessment. So the reason that we're doing this is because it becomes hard to track how youth are using the system across the system. They could only really get a better picture of those clients that had engaged with youth projects. But as we know, not every youth engages with youth projects. They may be engaging with PGM or Franciscan, some shelters that are there for the general community, but not specifically for youth, and thus they don't have those specific youth questions. And so this is, due to the inconsistency of these questions, and so that we can also be brought more in line with the framework for ending youth homelessness, we're identifying these questions and adding them to ensure consistent information throughout multiple projects. So the proposed questions, they fall in line with the core outcome areas of the federal framework for ending youth homelessness, which are stable housing, permanent connections, education, employment, and social emotional well-being. Now, the social emotional well-being portion of this will not be implemented. This is something that the group is still in conversation on how to best measure this. So no questions are going to be regarding these, but for employment, education, and permanent connection, we have a few questions that will be added from those general outcome areas. And so another thing is that this group is looking to collect information about pregnancy and parenthood amongst youth. So you all may be familiar, and I'm going to get into how this question's asked across multiple project types, but when we ask about pregnancy, it's usually, are you pregnant? And then it's a yes or a no. Whereas we're not really asking about parenthood. We're not really asking, do you have your child? Are you expecting a child with your partner? So male youth in experiencing homelessness in Cook County are more likely to report having custody of the children than male youth elsewhere in the country. And that's something that we're not collecting. We're not figuring that out through our system, because the way that we're asking people if they're if they have children or if they're expecting children, is really just, are you pregnant? Yes or no. And then if that child is there, they're linked with you in your assessment, and that's pretty much it. So we're being a little bit more intentional on asking these questions about parenthood and asking these questions about, expecting children in the household. So these questions were developed by the Youth Action Board members, by HMIS and youth project managers, and particularly by providers. Providers came together, shared their intake documentation with one another to sort of pare down on what questions were being asked across the board and come up with a way that they can ask these questions on a more consistent basis across every provider and not just one or two. So they have been doing focus groups on these questions, and the ones that we currently have are the ones that we're moving forward with. So keep that all in mind. Now, again, whenever possible, they sought to use questions that were already asked of a subset of youth. They try to incorporate any funder required questions, etc. So these are some of the things that they had thought of when they were developing the questions. So now let's look at what the actual questions themselves are. So once more, they fall into 4 categories. It's going to be education, employment, permanent connections, and then that additional fee, which are all 3 in the framework for ending youth homelessness. And then we have the pregnancy and parenthood questions. So education, we're going to be asking them if they are enrolled in school and what is their current current educational status right then and there. Then, what was the last grade that they had completed? And notice that we're not just asking about grades, but we're also asking about vocational training, etc. For employment status, again, we are looking to take it past just, does this client have earned income? We want to find out whether they're employed, looking for work, paid employment training, etc. And note that this question actually changed a bit. This is an old version of the question. We'll be previewing what the new versions of these questions are. Then we want to find out more about how many hours they're going to be working. And then finally, well, not finally, but for permanent connections, we have a question asking, there are people I can depend on to help me, and then it's just an agreement metric, whether they strongly agree, disagree, agree, or strongly agree. And then we have 3 questions for pregnancy and parenthood. And again, you could see that we're asking this in a different way than we would typically ask it throughout any of the other assessments. So immediately you could see that, are you currently pregnant or have a pregnant partner? That's really important because now that's capturing the males who may have a pregnant partner, etc. And then, are you a parent? Yes, no. And then what is the custody of that child look like? Now, these questions are all going to go live on the entry assessment, update assessments, and exit assessments, because each of these can change, right? Each of these are able to change throughout time. Maybe the client came in and they didn't have a pregnant partner, but now they do. So you want to be able to update that and give a new answer for that, as opposed to going back to the entry. So these questions are going to be present in all steps of the process. They're going to be present in entry, update, and exit assessments. Please keep that in mind. So I wanted to provide this crosswalk of where these types of questions are already being asked. So on the columns, you'll see the questions being listed out, and then the different assessments associated with them. So each of these assessments are assigned to a particular project type. You have PATH, which is going to be PATH outreach, RIE, which is the runaway homeless youth, and usually targeting just straight up youth. The COC and ESG entry, all of the projects, and then COC, ESG entry, emergency shelter, street outreach, safe haven assessments. Those are for the 80% of all providers out there that have just basic COC or ESG funding, either for permanent housing, emergency shelter, transitional housing, service projects, etc. And then we have SSVF, and then the youth providers assessments. And then finally, the DFSS IDHS supplemental. So I presented all of these just so we could get a sense of where these questions are being collected as of right now, as before we're implementing, how are they being collected? And you could see it's not consistent throughout most of the project types. And even where it would be consistent, like the RI or the youth provider, it's sort of a partial match. And when I say partial, it's because the questions aren't asking to the same depth that these proposed questions are. So take, for instance, the DFSS and IDHS supplemental. These pregnancy questions, these parenthood questions, are sort of on that assessment, but in a very simplified way. The only question on the DFSS and IDHS supplemental that gets towards pregnancy or parenthood is it doesn't even ask, are you pregnant? It just says pregnant, question mark, yes or no. And that's it. So I put down partial there because it is asking it, but not to the same depth, not to the same intention that these questions have been developed and are being asked. So how does this impact your data quality? These are not going to be weighed for data quality. The process to do so, if we did want to measure them, would be that it has to go through the data quality work group and the HMIS committee and make a decision on how they want to measure these questions for performance. So who do you have to answer these questions for? Well, the questions are optional, but they're encouraged for the majority of the population. I think these are questions that are very helpful, that give you a better perspective on your client and get you some more information, tangible outcomes as to your client's employment, as to what you're doing to help a client going through parenthood crisis, pregnancy crisis, whatever it may be. So we encourage you to answer them for all providers. But just know that in HMIS, these questions will be italicized, so you know that they are optional, so that they're not immediately required for every single client that you talk to. But one thing to also keep in mind is that these questions are really strongly encouraged, in particular for youth. So if you're just a general emergency shelter, you see adults of all ages, 18 to whatever it may be, we want you to pay extra attention to these questions if you're talking with someone who's between the age ranges of 18 to 24. That's really who these questions are sort of being targeted at. But again, I think these questions have enough value to be able to justify having these answered for every single client. But we're not going to force you to do so. They're just strongly encouraged. So what's next? Well, October 1st is coming up. We're going to be updating. That morning, you will wake up to a 2020 assessment. The AMI of the income will be changing. A lot of things in the assessment will be changing. So we can't preview that in HMIS, but we can preview some of these changes and what it'll look like on the universal intake form. So the link that I have here is linked to the article that has a universal intake form. However, we're not going to update that. The actual live universal intake form that we'll want you all to use is going to be sent out on Monday. So Monday morning, be on the lookout for that new universal intake form. And if you have more questions, shoot us an email at hmis@allchicago. But before we stop, I want to go to our universal intake. So again, this is accessible to everyone. This is on the help desk. I'm going to make this a little bigger. Oh, I don't know what I did there. Let me move this. So folks, this assessment is really there for you to be able to work with. You can take our logo. We're going to give you access to this through both PDF and through Word. So you'll have access to edit the logo, add additional questions, etc. But we ask that you don't touch the sort of base questions that we have in there, because those are literally on everyone's assessments, and those are things that you have to answer for every single person that you have. There's sort of no question as to whether you can alter them. They have to be asked in this way. Uh, um, but just keep in mind that you can edit this to your liking, put in your own agency name, customize it, really make it yours so that it fits into whatever your intake protocol is. Now, we have our typical demographics, and we always have these options of client doesn't know, client refused, data not collected, etc. We have veteran status and then sexual orientation. So this is optional for the general population, but not necessarily required for youth, just strongly encouraged for youth. And as we go down, we ask about ethnicity, primary race, etc. Then we get into the disability and healthcare information, and we've baked in some of these friendly reminders. So if your client has HIV/AIDS, we ask that you lock the record. Now we're explicitly reminding you to do so. Then we have secondary disability if they have more than one disability. And if they have more than 2 disability types, we ask that you just fill it out on the back. Then we ask the recipient identification number, what health plan they're enrolled in, whether you visited a primary care physician or seeked medical help in the past 12 months. Now we move into the domestic violence survivor questions. And once more, if a client is currently fleeing, the record must be locked, and we now provide you with a little reminder of that. So Laura Bass is asking, this is a great question, Laura. Can you address answering sexual orientation for minors? For example, if we are conducting intake with a head of household and they have a 16-year-old child. Laura, in that situation, I would recommend not asking it. So we're going to change the language of it being required for youth, but your program, you have a permanent supportive housing program, or those are usually the types of programs that you have. Yeah, it doesn't make sense to ask that to when the head of household is around. So use your discretion for that. But I would totally just not even ask the child that question. If their parent is around and you have a feeling that it may impact their relationship with their parent, or impact their relationship with you as a case manager. So ask that question at your discretion. You are the best judge of whether it's invasive to the clients and whether it may be putting a particular household member of that household in a vulnerable situation. So here we go, going down the domestic violence victim survivor, etc. And I have someone who's raising their hands. I'm not going to unmute you, so please submit your question if you do have a question. So prior living situation now has the chronicity attached to it. And remember, prior living situation, that question is just current residence / living situation. Now you'll remember that I sort of created this system for documenting the client's locations, and then the conditional logic that comes along with it. So here we have the prior living situation table is going to be having all of these, so this matrix is a little bit more, looks more complicated than it actually is. So if you remember, when you're entering a client into your project, when you're answering current residence / living situation, there's always that emergency shelter situation, institutional, and then transitional permanent housing situation, we just categorize them by that and list them out here. And we assign a number variable so that you have it right down here so that you can just sort of use this as a reference table to answer these questions in section 1, prior living situation questions, etc., and in section 2. So this looks a little bit more complicated than it actually is. So what page is this? Apologize, folks. So page 4 is really a reference to answer the following questions on page 5 and 6. So we have section 1, then we have our prior living situation questions, which is really asking, what is their typical sleeping arrangements? If you remember, those were some questions that we had rolled out earlier this year to try to identify those clients that are currently unsheltered. Then we have section 2, where we're asking about the length of stay in the prior situation. And again, all of this really works on a water flow kind of methodology. You could see that, you'll just basically be answering and you want to refer back to the instructions here. And then again, we have our final section asking about when this episode of homelessness started. So remember, episode of homelessness, not when their general homelessness started, but when did this series of homelessness begin? Now, then we move on to the current living situation, and current living situation also has its own separate tables because they're slightly different than that of the prior living situation. And also notice that current living situation doesn't have anything about typical sleeping arrangements because it's a little simpler. It just operates with a couple of questions, yes, no questions. So you'll indicate the current living situation and then this conditional logic of a yes or no, whether or not they're going to have to leave their situation in 14 days, whether the family has resources, etc. Then we move on to our income section, and this income section is again built to reflect how it looks in the sub-assessment, the income sub-assessment. And we have some more codes. And again, we use the codes because it's a lot easier that way. It reduces the amount of paper. Otherwise, you guys would have like a 20-page intake document. And then you'll notice that we have updated our area median income to reflect this year's new numbers. So just keep that in mind as you complete this for clients. And finally, we come on to the employment section, and the employment section is going to be asking questions about whether a client's currently employed, how many hours they work, etc. These are the things that we reviewed from the youth data proposed questions, youth data work group proposed questions. And then we move on to the non-cash benefits, which again is similar to how these sub-assessments currently work, and there's no major change to how these are going to be rolled out. Same with health insurance, same sub-assessment, no different changes there. And finally, we go to not finally, but we then go to education, pregnancy, parenthood, and permanent connections, which are all questions that we have already identified through the youth data work group. And finally, this is where all applicants must sign as well as agency representatives. Now, let's take a look at some of the questions that we have. We had a couple come in as we talked through this intake documentation. Sorry, folks, I'm having a little bit of trouble with my mouse here. Okay, so there's a question about DFSS updating their forms. DFSS, their auditors look at those forms. We have no say in how those forms are designated, what questions go on those forms. We don't have no say, and we've asked if those forms could be, sunsetted, or you could adopt our forms, but unfortunately the auditors literally have to see a yellow sheet. So So from my knowledge, they're not going to be changing much there. This won't be addressing any of the questions that we have from the HUD data standards. So DFSS will not be updating their forms. You'll still have to use those forms because that's what their auditors look for. Then we have another question. Is there going to be a supplemental intake form for family members, or are we to use the universal intake form for all people in the household, including children under the age of 18? You will be, you'd just be printing out this form for everyone in the household, because the questions collected here are going to be the questions that you're going to have to answer for those clients in the HMIS form itself, as well, in the HMIS assessment itself in the live site. Sharonda Peck is asking regarding the prior living situation. She's looking specifically at number 20 and 21, and thank you for addressing them by the numbers. It's really neat. Staying or living in a family member's room, apartment, or house, and then staying or living in a family member's room, apartment, or house. I think there's a slight change that's come into that, Sharonda. So we copy this over from HUD. I never understood it myself, so I think there is actually a friends situation. So that'll be updated. I think that is meaning that it's staying with friends as opposed to family. Is the effective date of the universal intake form 1019? I don't know what this question means, Kenyatta. Uh, if you could reword that question for me, is the effective date of the universal intake form 1019? I'm not sure what that means. But the intake form follows the HMIS data flow. So you'll notice that we're asking things very similarly to how you're inputting data into the HMIS assessment. And what you're seeing here is effectively how it's going to be presented in the HMIS assessment for general projects. So if you are a project that's a PSHES, you're not specific to youth or SSVF, a lot of these questions are going to look almost exactly how they're going to be ordered. But for SSVF, RI, some of these specialized providers, it's going to capture a lot of what you're asking, but some of those fields specific to that project type may not be asked. But just know that like a lot of the sections are going to be repeated even in your specialized workflow. And then Marianne Morris, the universal intake form is for those that are not already in the system. Yeah, that's right. We're also going to create a update form and a exit form as well. That's just sort of working off of this one. That'll be rolling out on Monday and sorry, not Monday. That'll be rolling out mid next week. We just want to have the entry assessment completed for y'all, and then we'll probably just copy and reorder stuff to be able to give you all a update and exit assessment to also use. But yeah, you do this intake form for anyone who's entering your project. Um, yeah, and know that this is sort of has a stamp of approval by us. It's asking all the things we need. So I'd highly recommend that you guys take a look at it and utilize it for your own needs. And know that it can be editable. You could add questions. We're not so specific that we want it to be just this. You can edit it how you need. Will the question in HMIS be taken off reason for current housing situation, which is located after homelessness history? That's still going to be in there, actually. That's still going to be in there. I'll have to check it back. And then, are we implementing use of this form as of October? Yes. So Kenyatta, we don't require that all of our agencies adopt our universal intake. It's really just a friendly guidance for you, right? It's a resource that you can use so that you don't have to sort of start from scratch and create something. So as of 1019, if you want to use it, by all means use it, adopt it, edit it, do whatever you need to do to get it out the door, to get it to your folks. but just know that if you do adopt this universal intake flow, you'll have all those questions that are in HMIS sort of already accounted for. And that seems about it for the questions. Let them roll in, folks. Let them roll in. We have until 2 p.m. The intakes for clients. Oh, that's a great question. Well, we need to update intakes for clients currently enrolled in projects. If they're currently enrolled, no, you do not need to. This is really going to only be impacting clients that are going to be entering your project. So this is not, if you have 100 clients enrolled already, you don't have to do 100 updates. You just leave those clients be. And any new clients that are coming in after October 1st will automatically have these data standards updates applied to them. And I'm recording this webinar. We were putting off wanting to record a webinar because we wanted to be able to show through some of the changes that'll be happening in Service Point itself. Unfortunately, we weren't able to do that, so we'll be recording this, putting it up on the help desk, and we'll be sending out the link to everyone to be able to watch the video. And we have a couple more webinar dates in the middle of October. If you want to, I'm sorry, not in the middle of October, in the middle of next week. So after the implementation's done, we'll be talking through the actual changes as well. If an assessor is placing, I got another question from Kathy. If an assessor is placing the client in HMIS and they're selected for a particular program, does that program need to redo the universal intake form? This is a this is a tricky question, Kathy. HMIS, we're not requiring you to. It depends on what you're funded. It depends on what your funder is asking for. Some, depending on your line of funding, you may need to have a physical file. If you're asking, like, according to HUD data standards, do you have to have an intake? Do you have to have XYZ? We don't have any of those requirements, but your funder may. So I can't say to, there's a lot of variables there to answer that question. So sorry about that. You could email HMIS at All Chicago and we can get a better answer for you if you want to give us a little bit more details. So I'm here for another 2 minutes, folks. Feel free to shoot your questions along. Otherwise, if you want to head out, make sure to download those handouts. Be on the lookout for a video that we'll be sending out on Monday. The changes are going to be going live on Tuesday. And any questions, any concerns, feel free to shoot them over to HMIS at All Chicago. Here we go. All right, folks, so I'm going to go ahead and close this webinar out. Thank you all so much. Thank you for joining me on this rainy, gray day, and have a good one.